Hi, I'm Laura from The Butterfly Mother. This is Sarah from Lotus Petal Family Support. Please subscribe to our channel for videos about parenting and mental health. Today we're going to be talking about the variety of perinatal mental health issues that can affect women that aren't just limited to postnatal depression.
We're going to be uploading a video every day this week in aid of Maternal Mental Health Awareness Week. There's lots of different bits and pieces going on, and you can find out more by following the Perinatal Mental Health Partnership, and we will link them below. Perinatal mental health can present itself in a variety of different illnesses, but one of the first things that we want to talk about is baby blues. Sometimes baby blues can be confused with postnatal depression. I think sometimes people will use the phrase baby blues to describe how they're feeling when actually it is postnatal depression. What's important to remember is baby blues is brought on by hormones after birth and will usually present itself in the first 3 to 5 days post-birth. Symptoms normally last up to 1 to 2 weeks. However, if you're still feeling tearful and you're still not feeling yourself after 2 weeks, that's when you should go and see your healthcare professional, whether it be your midwife or your doctor, because you could be then on the road to developing some kind of perinatal mental illness. I have a video about the difference between baby blues and postnatal depression, so we'll link that below.
So when people think of perinatal mental health issues, they usually focus on postnatal depression because that's kind of the one that most people are aware of. But perinatal mental health actually covers a wide spectrum of different illnesses, and they might require slightly different treatment. So these could include obviously postnatal depression, antenatal depression, which is where you're experiencing symptoms during your pregnancy, postnatal anxiety, which is something both Sarah and I really struggled with, postnatal OCD, which is related very strongly to postnatal anxiety, but again could present with slightly different symptoms. We've also got PTSD, which can be caused by birth trauma, and lastly postpartum psychosis, which is an extremely serious psychiatric problem that would need immediate medical attention. It's important to remember that often, although these are separate conditions, there is a lot of overlap, which is something that Sarah and I both experienced. So Sarah, if you wouldn't mind telling us a little bit about how they overlapped for you.
So I developed anxiety to begin with. I wasn't really sure what was wrong with me to begin with. It was definitely anxiety and maternal OCD. I had been diagnosed with OCD in my late teens, so I kind of recognised those symptoms very early on, and I kind of knew what I needed to do to get myself feeling better. And it wasn't probably until my daughter was about 6 months old that I started to realise there was something more, and it was actually postnatal depression. So for me, those 3 illnesses overlapped, and they all impacted each other really. I think the anxiety and the maternal OCD was probably what brought on the postnatal depression. So I was treated with, all 3 of mine were treated together. Again, the OCD, I kind of knew what to do with OCD because I'd had it before and I'd sort of worked on that a lot before. But with the postnatal depression, I'd never had depression before, so I didn't know where to start to get myself to feel better with that. So the 3 illnesses definitely overlapped. I know that yours overlapped as well, so do you want to tell us a bit about how yours
Yeah, definitely. So really similar to Sarah, I definitely experienced sort of postnatal anxiety, OCD and depression, and also a small amount of PTSD following a traumatic emergency cesarean. I think it's really important to mention that most of us think of traditional depressive symptoms of, you know, not being able to get out of bed and feeling unmotivated and stuff like that, and I think because that's how I imagined postnatal depression to be, I was actually experiencing quite a lot of different symptoms because mine was mostly anxiety based. I had a lot of energy, I had a lot of excess energy, I was on edge, I was having disturbing thoughts, etc. And I knew there was something wrong with me, but I didn't think it was a perinatal mental health issue because I was only aware of the sort of common depression symptoms. Like with Sarah, the depression came after for me, so it was initially anxiety, there was a fair bit of OCD in the form of intrusive thoughts and some compulsions, and then the depression came afterwards when I was unable to deal with the anxiety and it was having such an effect on my life. In terms of post-traumatic stress disorder, I don't think I actually had full-blown PTSD, but I definitely had a traumatic birth which had a big impact on how I felt about my son, and that then exacerbated the anxiety symptoms for me.
Today we're just giving a very brief overview, but we will be doing videos on each of these different illnesses coming up, so do like and subscribe to our page to keep up with these videos.
So should we be treating these illnesses individually? I feel kind of mixed about this. I think there are some pros to doing that, in terms of you might get better sort of specialist treatment. So you might get a doctor who's really great with treating OCD, and I think also treating them individually will help women to recognise these different disorders and not misunderstand what's happening with them. But there's also cons, as we've mentioned. Postnatal depression, postnatal anxiety, and postnatal OCD all very much overlap. So if they were to be treated individually, they'd have to be a really joined up approach from your healthcare provider. The other two perinatal mental illnesses that we mentioned are postpartum psychosis and PTSD, and we do think it's important for those to be treated individually, because PTSD can benefit from some treatments that aren't really relevant to other forms of anxiety and depression, like EMDR therapy. And postpartum psychosis especially is a very separate illness, is a very serious psychiatric emergency, and requires urgent and specialist treatment.
If your symptoms are much more anxiety based, and you don't feel like you're struggling with maybe postnatal depression, it's still important that you do go and see your healthcare professional. To find out more about what's going on with Maternal Mental Health Week, you can follow the Perinatal Mental Health Partnership, which we have linked below, and you can also follow us on Facebook and Instagram. We will be taking part in lots of the activities that are going on throughout the week. We will be back tomorrow with a new video, so do please like and subscribe to our channel to keep up to date with all of our new videos.